Hello everyone, my name is Donald Obasui. I will be teaching on the impact of technology in healthcare. I would like to ask a question so that we have to engage our uh, critical thinking. Why technology in healthcare? That is the question that one also have in mind. Um, I would say that the impact of technology in healthcare has been significant and continues to transform how medical services are delivered, managed, and improved. And also, technology helps healthcare professionals diagnose diseases faster, treat patients more effectively, and improve overall patient outcomes. So, with these two major points, it will help us to have an overview why technology is used in healthcare. And the second one is why does it matter for nurses? So, modern day nursing professionals needs this knowledge, technology knowledge within the healthcare sector, as it prepares nurses for safe digital care delivery, address complex technology challenges, and the last is that nurse educators must prepare nurses for safe evidence-based use of digital technologies. And this is why it matters for nurses. So the key impact of technology is explained in two major ways here. The first one is the improvement of diagnosis, and the second one is what? The improvement of treatment. So modern day technologies allow doctors and nurses to detect diseases earlier and treat them more accurately. For example, we look at the use of CT scans and MRI. So these are medical imaging equipment, data equipment, which is very, very useful within the healthcare system today. We look at artificial intelligence that is being adopted in so many healthcare in assisting with respect to disease detection. We'll consider the robot surgery aspect. You see how this technology works and improve treatment accuracy. So these tools help reduce human error and improve patient recovery rates. So the one here that we know and we work with every day is the electronic health record. It is very, very useful as it helps us to assess patient history for better communication among healthcare providers, like collaboration. It reduces paperwork and errors in terms of handwriting and also buying of papers all the time. So in other words, also reduces cost. Healthcare professionals can quickly see test results, medication, and previous treatment with the help of this electronic health record. So it's a very useful technology within the healthcare system. In telemedicine and remote care, we use a whole lot of digital tools, you know, to help save travel time, help patients in remote areas, reduce hospital overcrowding. So, for example, we remember that of COVID-19 pandemic, telemedicine became very, very important because of the restriction of movements and the whole lot. And another one is also the wearable health devices. For example, the smartwatches and the fitness trackers, which help to track heart rate, the sleep patterns, physical activity, saturation level. So patient and healthcare providers, they can monitor health conditions continuously with the help of these wearable health devices. So a digital technology is very crucial within the healthcare sector. We talked about how it encourages collaboration and communication among healthcare professionals. So, which is, for example, the specialists can review patient cases online. You know, they don't need to meet the patient in physical sometimes or meet other of their colleagues and start questioning them. So hospitals share medical data instantly, and international medical consultations are also possible with the help of this digital technology. So, overall, we will say that for better patient safety, technology helps to reduce medical errors. Through the use of automated medical system, barcode scanning for drugs, clinical decision support system. So these tools ensure the right patients receive correct treatments. So change, but however, there are challenges, despite that it's very useful, and we need to have this in mind. So one of the challenges that is very, very capital intensive in setting it up with any healthcare system. And also, we need to bear in mind the cyber security risk and data breaches. So, and following the um, data protection law or regulations is very important in this case. And also, it also need that we train staffs, healthcare personnel, to be able to use this technology. Otherwise, this technological equipment will be there. It will not use itself. People need to use it for oversight purposes and all that. And also another danger or challenges that comes along with this digital technology within the healthcare sector is that when professionals rely on it, so they might start thinking, they might stop engaging in critical thinking, which is not too bad, because when technology goes wrong, who are you going to hold? So using technology, there need to be a human loop for oversight purpose. They need to be a human in the loop, for oversight purpose. So these we should have in mind when using it. So in summary, I would say that the technology has greatly improved healthcare by enhancing the diagnosis, treatment, patient monitoring, and communication. So despite that, there are few challenges I mentioned earlier, but of course, this continued technical innovation will likely make um, uh, healthcare delivery more efficient, accessible, and patient-centered, so which is a good thing. So my final remark is that technology isn't just a tool that we use. It fundamentally reshapes how we deliver care, how we make decisions, and lead teams. So I believe this section has equipped you with the leadership skills to harness these changes safely and ethically. And I want to say thank you for listening to my lecture. Thank you very much.